Good afternoon, everybody. I'm Myra, and sorry for Wave Now's Ask the Doc. I hope that you are having a good Thursday afternoon so far. So we are talking with Dr. Mark Brockman, a pediatrician with Norton Children's, about illnesses that are floating around right now. What's bringing kids to the doctor's offices? I don't know if maybe you have kiddos right now that are dealing with some sort of bug right now. If you are, feel free to chime in here on this feed. Tell us what's going around in your house right now. I know when one kid gets sick, the whole household typically goes down along with it. So it's always a little tough to deal with when someone's not feeling well. So Dr. Brockman, thanks so much for chatting with us today. What's going around right now?
Sure. Well, we're starting to get into our busy season, so we're seeing a lot of different viral infections, what a lot of people would just call a head cold, but there's a lot of different viruses that are out there. But of course, we're starting to see RSV. Luckily, I haven't seen any flu cases yet, but that's coming. So a lot of different things like that.
Is it kind of confusing right now with everything going around? A couple of weeks ago, I had COVID, and, it's kind of a lot of things happening: RSV, COVID, potentially flu, a cold, allergies. I mean, the list is long.
Sure. Yeah, and a lot of parents, they want to know, is this a virus? Is this allergies? Is it something else that's going on? So don't hesitate to talk with your children's pediatrician. But when it comes down to it, you don't necessarily have to know exactly what virus is causing the infection, depending on the child and the exact situation. So everybody's a little bit different, but for the most part, this is going to happen. It's a normal part of childhood, and it's okay. But it can be stressful for parents and for physicians, especially when we get farther into the season.
You mentioned that you're seeing more cases of RSV. Can you talk a little bit more about that? What is RSV? What are the signs and symptoms?
Yeah. So RSV, it stands for respiratory syncytial virus. It's something that's been there for forever. It's something that can potentially cause children to be a little more sick, but it varies in its severity. The younger you are, the more serious the case can be. But even the younger children can just have anything from a little snotty nose up till what we call bronchiolitis. Bronchiolitis being the most severe case of what RSV can do. Bronchiolitis is a lot of mucus production in the lower airways and cause a lot of respiratory troubles, especially in younger kids who not be able to clear those what we call secretions or mucus production. So it's a varying degree of it. And again, it just depends on the child's age and that kind of thing.
So at what point, Dr. Brockman, do you think parents should be like, okay, maybe we should go check in with our pediatrician. Maybe we should see a professional right now?
Yeah. So I get that question a lot. And if you're ever nervous or concerned or just have questions, please don't hesitate to call your pediatrician. That's part of our job, is to help parents through these kind of illnesses and let them know the worry signs to watch out for, and if there is anything more serious going on. But the biggest things to watch for, when I warn my patients and parents on, is child's work of breathing. Are they working hard? Does it look like they're labored at all? Are they using, we call it accessory muscles, your rib cage, your abdominal muscles to help breathe? Those are emergencies, and that's a reason you might even want to go to the emergency department. But also to dehydration. Sometimes when you get infections like RSV and bronchiolitis, you can have troubles keeping fluid down or getting enough fluid in. So those are some real reasons to go to your pediatrician. But again, if you're at all concerned, don't hesitate to give them a call.
Any concerns from coming off a fall break for kids, and illnesses they may have picked up while on vacation, heading back into school, the impact of that. Is there an impact?
Well, when we're going into this time of year, a lot of reasons why these are starting to be spread around is because we're getting in closer quarters. We're going to stay inside more. We're more closely packed in, so it's easier to spread those things. So kind of depends on what you did. If you were hanging out outside and just with your family, maybe camping or something like that, most likely you're not going to bring anything back. But if you were flying and you were in close quarters with a lot of people, you might want to watch for runny nose, cough, and fever, and that would be a reason you want to stay home and take those extra precautions so you're not spreading it around to the rest of your friends and family.
Okay, so you mentioned RSV. That you're seeing right now, a couple cases of that. What else, Dr. Brockman? Anything else that's floating around that parents should be like, oh, I need to be on the lookout for that?
Well, again, it's doesn't necessarily matter what that virus is, but of course there's different kind of coronaviruses. Everybody's heard of COVID, obviously, and that's a specific one that could be floating around. It could just give you a head cold, especially in your pediatric populations. Rhinovirus, enterovirus, and then again, flu is coming. So that would be the biggest one I would like to warn my parents about is flu. And some of the things parents could be doing, especially to prevent a serious infection, would be making sure that your children have received the flu vaccine this year.
Okay, and let's talk a little bit more about that because that was where I was going with my next question. The flu vaccine, what options are there? What would you like to tell parents? I know so many people are concerned with the flu vaccine. They think, oh, if I get the vaccine, I'm going to get sick, or, I'll just take my chances. What would you advise to folks?
But what I always like to tell my parents is, number one, always ask me questions about any of the vaccines that your child may be receiving, no matter what it may be. But especially with the flu vaccine, it's a very important vaccine. And when I tell parents that, what I mean is it's a important vaccine because it's effective. And what I mean by effective is it's effective at keeping children from getting severe cases of the flu. It's a very good vaccine at keeping those children from getting very, very sick. It's not going to keep you from getting the flu. And no, it won't put you at an increased risk for getting the flu, and you can't get sick from it. But unfortunately, there will be some severe cases of the flu, and it will be in our pediatric population this year. So the biggest things parents can do is get an appointment with a pediatrician and get that done sooner rather than later, because it does take some time to build immunity in your system. So you don't want to come in contact with it with the flu once you're in flu season without being covered by a vaccine.
And that's always a thing to remember is that just because you got the shot doesn't mean that it's immediate, the impact of it. It takes some time for it to kind of kick in and give you that full immunity.
And again, it's not there to prevent you from getting the flu necessarily. It's there to keep you from getting severely ill from the flu. And we know without a doubt, children that are vaccinated, especially on a yearly basis, aren't going to get as sick from the flu. They're not going to have those severe cases.
Dr. Brockman, I don't know if you can talk about it, but if you can, obviously COVID's still going around. We're not done with it. We know that the updated booster COVID vaccine is out right now. Is it available for kids? Should parents consider doing that? And is it a good idea to do flu and your COVID vaccine at one time?
So it'd be perfectly fine to get those vaccines at the same time. They work differently and obviously completely different viral infections. When it comes to the COVID vaccine, you definitely need to have that conversation with your pediatrician, but it is available out there. It depends on what is your situation. Are you in a home with people who are at increased risk of if they get COVID? Again, this vaccine, it's going to be something that's always going to be out there. COVID, something we're always going to have to deal with. We've known these coronaviruses have been present forever. But if you've gotten any of your other vaccines and your boosters, you're perfectly fine to get those all together this year. And it's going to be something that'll be available yearly.
Okay. And another thing I want to talk to you, Dr. Brockman, about is that you all are seeing a number of people bringing their children into the ER, where maybe choosing the ER is not the best option. I know sometimes as parents, I freaked out and I'm like, oh my goodness, I just need to get you help immediately. And you think ER. But sometimes that's kind of tricky, right?
Yeah, it definitely can be tricky. And it's hard for parents. And I understand we're tired and we're stressed, and especially as we get into January, February, March time. Your child may have had multiple viral infections, and you feel like it's never ending. But again, most of the time, 99% of the time, this is a normal process. Everything that, just as being a person, you have to go through. Your body has to learn how to fight these off, so you're not staying sick as a teenager and an adult as much as you did as a kid. So some of the things that obviously parents need to watch out for, like I talked about, is the increased work of breathing. Is your child labored? Are they using accessory muscles? Are they using their belly? Are they breathing fast? Is their chest sucking in? Those are reasons to go to the emergency department. Are they getting dehydrated? Maybe they haven't had a wet diaper in 12 to 24 hours. They're not taking enough fluid in. Those are reasons to go to the emergency department. But if your child's watching TV and he's drinking and he's got a fever, that's okay. And we let them, have that. That's your body's natural response to infection, and is actually a good thing. A good thing to have a fever. 101, 102, that's great. That's actually a normal response, and nothing to be too alarmed with, as long as the child is otherwise doing okay. Now, of course, that's different for different ages. If your baby is a month old and they have a high fever, that's going to be an emergency and a reason to go to the emergency department. But if they're 6 months old and have a fever, 102, even 103 is perfectly fine, as long as they're drinking okay and not having any labored breathing. And it's okay to give Motrin and Tylenol at that age, alternating. And again, don't hesitate to call your pediatrician, but not really a reason to rush to the emergency department.
And why is maybe going to the emergency department not the best course of action if you're not in a critical state?
Yeah, so obviously those resources there are there for an emergency, and you're going to have a lot of a wait time there that you wouldn't otherwise have at your pediatrician. You may wait a few hours, especially depending on how many emergencies are actually present there, and you will come into contact with other people who are sick. So if you're sitting in the waiting room and maybe all you do have is a mild case of head cold, you may come into something a little more serious like the flu that you wouldn't have otherwise come into contact with. So I recommend highly that parents try their pediatrician first, if at all possible.
Okay. Dr. Brockman, this has been really good information that you provided to folks today. Is there anything that I didn't ask you that you would like folks to know about regarding this topic?
No, I think we covered a lot of good stuff, but again, I reiterate good hand hygiene, making sure that we're staying home when we're not feeling well, keeping some things like Pedialytes or some of those low sugar Gatorades on hand, just to make sure that we're keeping everybody hydrated, and really think about those supportive things that we can do at home with nasal suction and warm showers to make sure we're helping keeping the airways clear. And have those conversations with your pediatrician. Don't hesitate to call them, and you'll do fine this season, this cold and flu season.
Yes, we will get over this hump as we do all the time. Dr. Brockman, thank you so much for your time today and letting folks know about what's floating around right now with the kiddos. I appreciate your time. And again, always talk to your pediatrician if you have any concerns about your child's health. I'm Myra Ansari with Dr. Mark Brockman from Norton Children's Pediatrics, and I hope you have a wonderful day.
Thank you all.
Thank
Bye.
you.